Cleaning your hands frequently is a critical part of infection control. So we want to make sure we're doing it right by following CDC guidelines. Using alcohol-based hand sanitizers that contain at least 60% alcohol is the preferred method for cleaning your hands in most clinical situations. You should clean your hands with alcohol-based hand sanitizer immediately before touching a patient, before performing an aseptic task like placing an indwelling device or handling invasive medical devices, before moving from work on a soiled body site to a clean body site on the same patient, after touching a patient or the patient's immediate environment, as well as after contact with blood, body fluids, or contaminated surfaces, and always immediately after glove removal. To clean your hands with hand sanitizer, check the label for the correct amount of product you should be using. Apply the sanitizer to the palm of one hand. Rub your hands together vigorously. Rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take about 20 seconds. Now, there are a few instances when you must clean your hands with soap and water, not hand sanitizer. You should always wash with soap and water when hands are visibly soiled. After caring for a person with known or suspected infectious diarrhea, and after known or suspected exposure to spores such as B. anthracis and C. difficile. You should also wash your hands with soap and water whenever they are visibly dirty, before eating, and after using the restroom. Make sure to follow these best practices for washing your hands with soap and water. Wet your hands with clean, running water, warm or cold. Apply soap. Lather your hands by rubbing them together with the soap. Lather the backs of your hands between your fingers and under your fingernails. Scrub your hands for at least 20 seconds. Rinse your hands well under clean running water. Dry your hands using a clean paper towel or air dry them. Use a clean paper towel to turn off the tap. So please, do your part to protect yourself and others by following these recommendations every time you clean your hands.